Good morning, everyone. Welcome back to my YouTube video channel. Today is around noon time, and here in California time, I have Mr. Michael Gould, former CEO of ScriptNow, on the line, and I'd like him to have an opportunity to introduce himself and share the wisdom and knowledge that he's been through this industry of dentistry and healthcare for more than 40 years. So I want to be short. I want to have Michael have a chance to introduce himself and talk about how he get involved with dental medical field. Please, Michael.
Dr. Hung, I want to thank you for the privilege of making this podcast for your viewers. I got into the healthcare field back in 1970. I worked at Blue Cross, and one of the places I moved into was the administrator of a new product called Group Practice Dental. It was the forerunner of DentalNet, which is a dental HMO. They built that concurrent with HealthNet, which was a medical HMO. And I found I enjoyed working with dentists. It was a capitation program, which was not insurance, but essentially the doctors were paid per member per month. And it's an HMO type product, and I enjoyed it. I wound up spending 4 years as the administrator of that program of the 8 years I was at Blue Cross. Came to a point where, while I was doing monthly meetings, running the program with our dental board, there were a few of the members on the board that, unbeknownst to me at the time, owned a small dental HMO called Oral Health Services in Encino, California, in the San Fernando Valley. And in talking, I mentioned in passing that I was looking to move on. I wanted to expand my horizons and things I could do. And they offered me a job to be their operations manager. And being young and aggressive, I said, I tell you what I'll do. I would love to work for you. There were a total of 6 doctors. And I said, I'd love to be part of your dental plan, but I would like an opportunity in the future to become a partner. Mm-hmm. And we agreed that if they were doing about $300,000 a year, I said, if we could take it to $1 million a year, can we start negotiating for a partnership? And that took about 2 years, and I ultimately wound up as the managing partner of the company. And back in the days, from about 1970 through 1979, we were probably the second largest dental HMO in California. We wound up selling the program to a large dental HMO in Michigan, which by coincidence, 25 years later, my family and I are now living in Michigan, and gave me an opportunity to understand much more in depth the dynamics of running a dental HMO, not as an employee of Blue Cross, but as a partner building the company. We had about 260,000 members when we sold it. Took about a year off. This was back in 1989. Went back to school 3 nights a week for fun. And then I went on an archaeological dig through, if anyone is in Los Angeles, that sees it, the California Museum of Science and Industry went out on an archaeological dig that I joined them. I was actually volunteering in the paleontology lab. And I had the opportunity of discovering about anywhere from a 10 to about a 30,000-year-old mammoth molar. I joke with dentists that this is I guarantee you never extracted a molar like this one. And there is a link that I believe Dr. Hung will put on the podcast, so you can see it. I think you'll find it interesting.
I read that article.
I moved on and built another company called Managed Dental Care. And I built that company up. I had one partner, he was a union consultant. And in 1996, we sold the company to Guardian Life Insurance in New York. My partner retired and I stayed on for 3 years as the CEO of that subsidiary, which was having a 1,000-pound gorilla marketing with me was a really awesome opportunity. When my 3-year contract ended, I had put together with a gentleman who partnered with me previously, along with a cardiologist, an elective imaging program doing heart scans, lung scans, virtual colonoscopies. And we developed it as an elective imaging PPO, and we gave it away for free to employers as a premium free employee benefit, which was probably one of the most enjoyable companies I built. After I moved here to Michigan, I was contacted by the ADA. They asked me if I would be willing to be their keynote speaker for their National Dental Benefits Conference, which was an enjoyable experience, making a presentation to about 300 dentists.
Michael,
And basically,
may I stop you right there? Would you mind to, in a brief summary, like what were the talk that you present to those 300 dental people there? What were your key points?
One of the things that I found is that no matter how long, let's say, a healthcare practitioner is in business, the expression of we stay in our own lane, many of them contract with half a dozen PPOs or maybe HMOs, but they don't really understand the contract. They don't completely understand the funding mechanism, because the most common one is just traditional insurance. So one of the things we discussed in the room is I asked a rhetorical question, and I said to the group, by show of hands, how many of you have at least 5 or more PPOs you contract with? If someone took the name of the company off the check, would you even know how you were being reimbursed and by who? I then said, here's a question. How many of you believe that if you have empty chairs, you're losing money? And a bunch of hands went up and they said, well, you know what, we're paying our rent, we're paying our staff, so I don't think we're losing money. Immediately there was a debate. The other side said, well, of course you're losing money. And I let them go for a while, and I said, here is the answer. The second group is right. You have X amount of operatories, you have X amount of chairs. You have someone in terms of your rent, your utilities, and your staff salaries. If you're not putting people in the chair, for every time you're not filling your chair, you're winding up losing money, because ultimately that's the only revenue that you have. And it was an interesting experiment, because for a lot of people, they hadn't really thought about it in that context. One of the things that, depending upon a group that I might talk to, if they're they've been in practice for a while, or maybe they're looking to find ways to grow the thing. Because one thing I found throughout my entire 30 some odd years in working directly with dental is that the one thing every dentist wants is more patients. It's pretty simple. How do you get the patients? If it's a seasoned practice, in theory, you should be getting patients from referrals. If your current patient base, if they're happy, typically will make referrals to friends or relatives. If it's more of a newer practice or you're looking to expand, what do? I had a young dentist contact me last year, and we did kind of a quid pro quo. He wanted some information from me, which I was happy to give him. And then in turn, I wanted him to develop a very simple software program. But one of the things he was telling me is that he wants to get very involved in doing implants. And of course, implants are not covered by insurance. And the bigger issue is, how are you generating that? And he told me something that I knew nothing about. He said, using Google, and we all use Google for one thing or another, he said there are programs that you can go through within Google to do a data search. And he said the data search that I'm doing is basically saying within X amount of zip codes surrounding my dental office, how many searches for cheap implants, inexpensive implants, affordable implants, whatever the particular search term was, how many people looked for that? And he said, I'm mining that stuff. And I've got the person that's identified the person. I'm reaching out to them. And I thought that was really clever because I didn't even know you could do that. Another thing comes with, I shared this on occasion back in the days when I was at Blue Cross. I had a dentist that I serviced. Actually, it wasn't even Blue Cross. It was over, I think, at Oral Health Services. And he was a young dentist, very flamboyant, with a bow tie and kind of like white buck shoes. And his wife was an artist, and she made very pretty coloring books for kids. And what he did is he sent out a letter to every dentist in his zip code, introducing himself. And he said, I wanted you to know I'm new and that I'm open 7 days a week. So if you have any patients who wake up Saturday morning or Sunday morning with a really bad toothache, they don't have to wait until Monday. You can give them my number. I do emergency care and I'll be happy to treat them.
That's a good advice.
The other side of the coin is that when they saw that his prices were dramatically lower than the competition, they wound up staying with him as a patient. But I thought it was funny because, quite frankly, I've never thought of marketing your practice in that way.
Yes.
So, you got to be creative today, especially today.
Very
today
creative.
Difficult.
Good. Michael, and so in terms of the, for the knowledge of the audience, a lot of them don't understand HMO and PPO, and you mentioned that you work with Guardian Blue Cross before. So those are the company that finally bought your company?
I sold the first company to a large dental group in Michigan. The second one, I sold it to Guardian Life Insurance, which is a very large insurance company out of Manhattan, New York, and they have an insured dental plan, but they wanted to have a managed dental care, as dental HMO. You asked an important point, Doctor. When we talk about funding mechanisms, and it's kind of boring, it probably could do as good a job as Novocaine, but everyone is familiar with insurance. And with insurance, the insurance company is on the risk for paying whatever the bill may be, as long as it's covered. So typically, let's go within just dental. So one of the things that has not changed in the close to 40 years I've been doing this is that the average dental plan today is probably not much more than about a $1,500 annual maximum. And it's typically like a 100% for tier 1, 80% for tier 2, and then 50% for tier 3. So if you look at, let's say, doing Crown and Bridge, and I'm a little off because it's been a long time since I've been directly in dental offices, but let's assume that one could do a crown depending on the precious metal. They charge conservatively, let's say $1,500, and I'm sure it may be more, but $1,500 on a type 3 service, they'll pay half, and then the patient pays half. So if you get 2 crowns, you're done for the entire year. But the insurance is responsible up to the maximum. That's insurance. Then we move into a PPO, a preferred provider organization, which is basically where everyone has moved today. Nobody pays fee for service because the insurance company is not able to control the utilization. So what they do is they say, if you would like to be in our program, which is fine, we want you, we'd love to have you as our provider. Let's assume, and again, I don't know, I'm using an example. So let's assume, for example, that you do 2 pro fees a year, and an adult pro fee is $100. So for that patient, the doctor makes $200 for that pro fee, less the cost sharing with the hygienist. The PPO says, okay, we will pay you, obviously there's a PPO fee schedule, we'll pay you $60 for that pro fee. And my guess is that most doctors would say yes. Now, a question I ask rhetorically, so do they develop a PPO for the patient, or do they develop the PPO for the doctor? And the truth is, it's neither. The reason for the PPO is, if you think about it, if the doctor's normal fee is $100, but they're willing to accept $60, the doctor is saving $40 times 2.
Mhm.
He's saving $80 on one line item, and they probably do tens of millions of pro fees a year that they pay for. And now you compare that across the entire scope of dental codes, and that's really what the PPOs are about. And it's not bad, but it's the reality that the insurance company tries to mitigate their claims as much as anybody else. The third thing is the industry that I spent the most time with, and that's in a dental HMO, and they're paid by capitation. And capitation is essentially, we're paying per member per month. So it's a closed panel. The doctors on the panel the patients can only go to them because you select the office that you want to go to. And then they have a copayment. And then anything beyond the copayment, the doctor is on the risk. So, let's say, go back to my example of a crown. So if a crown, the retail on a crown is $1,500, and let's say that the copayment to the patient is $500 or whatever, and the doctor's getting money every month, whether the patient comes in the office or not, that's all the doctor receives, because he is being pre-funded. Basically, he gets so much per single person or two-party or family, and they get the money whether or not the patient comes in or not. And years ago, I don't know to what degree dental schools discuss it today, but what you look at is how long will it take to take patients from active care to being stabilized, where basically they're coming in just for maybe a prophy twice a year and an exam. So that's essentially the major differences between the three funding mechanisms. And quite frankly, I was kind of, go ahead.
In my opinion, the HMO insurance nowadays getting really bad. Not for the patient, not good for patient, not good for a doctor, and I don't know. In my opinion, I don't think it's workable anymore. It's getting really bad, Michael.
I'll tell you something interesting. As the CEO of a company, well, and back in the 80s, I was a managing partner.
Yeah.
We'd go to a number of meetings, dental meetings. We belong to the dental associations and all. I paid more money to my doctors than any of my peers, and they used to kind of give me a, kind of a poke and say, "Why are you paying them so much? We're paying a lot less. We're making more money." And I said, "Let me ask you a question. Patient comes in, needs a fair amount of restoration. Last time I checked, there's a dentist who's working in his mouth, not your salesman, not the VP, not the owner of the company. Do you really think if you're shorting the dentist in terms of reimbursement on the co-payments and reimbursement on the capitation rate, that they're going to see your patients? Or they're going to push it back? You'd be lucky if you get the work done in 6 months." And that was the truth. Now, where we are today, the industry has contracted substantially. When I was running oral health services, there were about 45 dental HMOs in California. I believe we were the second largest. Over the years, by the time we got into the 90s, all of the major dental insurance companies were gobbling up the smaller dental HMOs, so that you don't have nearly as many. Now, one other delivery system, which is not a funding mechanism per se, but a business model, are the DSOs, the dental service organizations. They are huge. I know in California, you got Pacific Dental Services, PDS, which has probably got 1,000 or more offices. Here in Michigan, you have Aspen Dental. You've got back when I had a company I was with as an independent rep for 10 years, providing prepackaged medications to dentists and physicians. One of the things that I had as a client was a dental a dental DSO in 12 states. So these are really large, very well organized organizations, and they do present a clear, I won't say a warning, but the fact is that where you have somebody who's in solo practice, or maybe a couple of doctors working together, and you have a large DSO company that has a practice in the neighborhood, at the very least, you may want to know what their hours are, because if they're open 6 or 7 days a week, if their price structure is lower than yours, if they're providing all of the specialty care in the office, whereas you're sending somebody out to a periodontist or an oral surgeon or an endodontist.
Let me ask you a quick
Well,
question, Michael. Do you think
sure.
the DSO organization receive different reimbursement than the private dentists who receive who contract with HMO?
With respect to a DSO, most of them, I believe, are on the insurance side. Now, some of them may well be doing the dental managed care, but my guess is it'd be more traditional insurance. But they're very aggressive. Like here, we have a lot of Aspen Dental commercials running on TV. I'll see them occasionally, and then they'll promote the fact that if you have no insurance, come on in anyway. We'll give you a full exam and full mouth X-rays to see how you're doing, and we won't charge you.
Uh-huh. So,
That's
but what I'm saying, I'm saying that you mentioned about the DSO and how they operate, and they work with a lot of HMO company. And my question is, are you aware that they have better contract with the HMO insurance compared to the private dentists who also want to contract with HMO?
I'll be honest, I don't know for sure. And the reason I say that is I don't want to pass along information that may not be accurate.
Mhm.
When you have an independent dental HMO,
Mhm.
you are contracting directly with dentists. Like we had over 1,000 dentists in California, both general dentists and specialists. With respect to a DSO, they own the offices. It's their office. So my sense is maybe whether they're contracting with the dental HMOs and not to become a provider, I'm not sure. But I mean, the way I hear them advertised, it appears to be more of a fee for service, but I could be wrong.
Yeah, I mean, why would you go to a big organization for dental care and it's versus you go to a private office where you have a dentist who will personally care for your teeth. So, that's kind of.
Well, with respect to I apologize for the ringing phone. My wife will pick it up. With respect to the offices that's like in the DSO, those are all private offices. They hire the doctors. They work for the DSO. Many of them will make an arrangement over time with maybe where they bring in somebody out of dental school. They become an associate. They work there for a few years. They learn, how to run a dental office, and then many of them are given an opportunity to buy the practice.
Mm-hmm.
So,
Michael, we have about 6 minutes left, so I just want to see what are your experience that you can share to young dentists out there or seasoned dentists. What are your advice in general as far as dentistry life? Anything you can share with your many years that you've been with this industry and in medical. Give us some advice, Michael.
I would say that the most important thing, and it's simplistic, is running I accept the fact that people go into medicine or dentistry because they genuinely want to help cure people and improve their health.
Mm-hmm.
But it's still a business.
Okay.
And it has to be run like a business.
Okay.
And one of the things is you need to know what it costs you to operate the practice, because some of it that you've got a lot of things that may have ebb and flow in pricing, but generally speaking, you know what your rent is, you know what you're paying your staff, you know what it's costing you to buy your supplies, and you need to be able to factor that out so that you know exactly where you are month by month. And what do you need to do if you want to grow the practice? Because there are a lot of practices I've known over the years that they were marginally profitable.
Mhm.
In medicine, including my own family physician,
Mhm.
he's got 4 people in his office, and they finally bit the bullet and sold the entire practice to a very large medical organization in Michigan, and now they're just employees.
Mhm.
Many dentists find they're not making it, they sell it to a DSO. So you need to understand what it costs to run the business. With
Okay.
respect to how you market the business,
Mhm.
you need to find ways to reach out to people, whether it's by direct mail. I'm not sure how effective that is in the long run, running a special, attending health fairs, doing things to be able to get people within your community to know who you are. Maybe you provide some services to to families that are on hard times.
Mhm.
Maybe you get some news on the doctor doing these types of things. But it's important. The other thing is, if you're an associate, it's more than just a job, because it's going to be a production-based job. Learn what they do. Try to learn as much as you can about running a practice, because at some point, most doctors, when they graduate school, they want to be an entrepreneur. They want to own their own office,
Mhm.
and it's great. I've been an entrepreneur most of my life, but it also, you can lose money. So you need to be prudent in terms of how you spend your money and what you buy and that type of thing. I'd like to say one other thing for the few minutes we have left. I want to thank you for the opportunity to do your podcast. I know that you've got a lot of people who respect you and watch these podcasts. I hope the audience, as well as you, Doctor, found this informative. I've done consulting over the years. It's typically ebb and flow. It just depends upon availability of time. But if anyone has any questions, any viewer, you're welcome to drop me a note. My email address is mike@ScriptNow. S as in Sam, C as in Charles, R-I-P as in Paul, S as in Sam, N as in Nancy, O-W, scriptsnow.com. And I'll give you my cell phone number. It's a California number. It's area code 805-320-5783. And I may be able to answer your questions. I've done some consulting. I was actually hired by an attorney to be an expert witness in litigation between a particular dental HMO and a very large dental insurance company. So I've done a lot of different things, and if it's something that I'm not familiar with, obviously, I won't do anything if I can't help you. One final comment, and then we can end it here. You're in an amazing industry. Modern dentistry today is nowhere like what it was when I had 5 dentists for partners. Things are changing. Things are changing in real time. I hope to be working with a company that has a virtual reality headset. I mean, this is something in the thousands of dollars. It's not a toy that can be put on a patient
Mhm.
while you're doing maybe an extraction or endo or perio, and without the Novocaine or the local anesthetics, they are completely immersed in the virtual reality, and they've done multiple doctors' offices and multiple white papers, and I'm really looking forward, hopefully, to work with them, because I've got a few ideas on how they can grow their company and maybe work with them along the way.
I'll be more than happy to give it a try if you come up with something from your collaboration, Michael, and let me know how I can test the product and things like that. And Michael, I would like to really appreciate your time here with me today, and hope to see you next podcast. Michael, have a great day.
And you know what? You too, sir. And again, thank you for the time.
Thank you. Bye bye.
All right, take care. Bye.